This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center. Dr. Cindric, good morning.
Good morning, Dave.
Appreciate you coming by. We're going to be talking about vascular surgery today, but first, as you know, we have to talk about you, at least for a minute or two. So give us a little bit of background on yourself. Where are you from? Education, training? How did you end up with Mon Health?
Well, Dave, I'm fairly local to the area. I was born and raised in Uniontown, Pennsylvania, and spent most of my formative years here at West Virginia University many moons ago. I relocated to central Pennsylvania, where I did general surgery residency, vascular fellowship, and spent about 10 years on staff before I decided to move on. I came to Mon Health only about a year and several months ago, just because it seemed like the perfect opportunity to be in a community medical program, or community medical hospital rather. There was a definite need in the area for vascular services, and I have roots to the area, so it just seemed like a perfect opportunity.
So, well, how's the last year been?
It's been a wonderful startup. The hospital is very accommodating. There's a lot of programs that I'm trying to develop in parallel, some quality improvement metrics, increasing the inventory, increasing the overall platform. It's taking an explosive effort. There's just too many things day to day to list.
So what drew you, I'm sure we talked about this before, but what drew you to surgery and in particular vascular surgery?
Well, I think vascular surgery chose me rather than me choosing vascular surgery. When I was a third-year surgical resident, I was having the typical existential crisis that most surgery residents do at that time, figuring out what they want to do with their lives. And when I had rotated on vascular surgery, and from that moment, I was hooked. I just liked the scope of procedures, the technical detail, the preoperative evaluations, and the continuity of care associated with a vascular patient. It just seemed like the perfect match for my personality.
So when we're talking about vascular surgery and the vascular system, what are we talking about?
Well, often people confuse vascular surgery with cardiac surgery, and so this is a good distinction. I mean, I often tell patients the heart is simply a mysterious black box that pumps blood to the vessels that I'm interested in. So I work in association with cardiac surgeons for the full spectrum of care, but basically I take care of most things outside of the heart and outside of the brain. So if it's the abdominal aorta and branch vessels associated with it, vessels in the extremities, vessels in the neck, anything in that purview. If it's isolated to the chest, then it's mostly the heart surgeon. So
the heart surgeon works on the heart, and you work on everything that the heart pumps blood to. If to boil it down, is that a layman's description?
That's an appropriate generalization. Yep.
So we're talking to Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center. What are some of the most common types of vascular surgery that you deal with?
Well, given the need of it, I would say that probably a good 40% of our practice is dealing with blockages in the lower extremities. Some people will come to us because they have trouble walking with pain and cramping in their legs. Other people have wounds on their feet that they can't heal. And there's just an enormous number of patients out there that have blockages in their blood vessels that are chiefly responsible for those conditions. And that takes up probably the largest minority of our practice. Another condition is strokes and cerebrovascular disease. Not all strokes are related to carotid artery disease, but that's an important fraction of patients that we counsel and sometimes will operate or put stents in to reduce the risk of recurrent stroke. Also, aortic aneurysms, it's approximately the 10th leading cause of death in the country. And it's something that is often only picked up when there's a dedicated screening program or surveillance, because you can't find them on physical examination. when they get to an appropriate size, then we consider surgical intervention to stave off sudden death from ruptured aneurysms. So that's just a small sampling of some of the things that we do.
Go back to blockages in the lower extremities. When you're talking about blockages, are we talking blood clots? Is that a result of vessels? What are we talking about there?
So when we're talking about most chronic arterial problems, it's related to atherosclerosis, or what we affectionately call hardening of the arteries. Hardening of the arteries is just plaque in the arteries that develops from sometimes genetics. It can run through families and families that are at risk for it. But there's a lot of variables that are accountable in our own lives, like smoking. Definitely far and away is probably the single biggest risk factor for hardening of the arteries. Also diabetes, high cholesterol, and high blood pressure. Those are the things that control for plaque in the arteries. And they can give, so when we say blockages in the vessels, we refer to hardening of the arteries, and that's usually a chronic problem that develops over decades.
What are some symptoms that you may recognize that would indicate this condition?
Well, as we were mentioning, that some patients will have a wound on their foot, whether it started incidentally or whether it was related to like a minor trauma or even a minor procedure from a podiatrist, and then it just refused to heal and only got worse. That's a tip-off that something's not right with the healing process, and sometimes it's related to blood flow. Other patients have constant pain or cramping when they walk. Each and every time they try to walk a certain distance, their muscles feel exhausted, much like they've ran a marathon, but their level of activity can't account for it. And so these are some of the situations that would give us the clue that there might be blockages in the arteries.
Talking to Dr. Matthew Cindric, heart. Pause for edit. 3, 2, 1. Talking to Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center. Before we take the break, you can take this portion here because I know it'll come up. And you've already sort of mentioned it once, but when it comes to the vascular system, lifestyle choices can play a big role. So if you have a bad diet, you don't exercise, and you eat poorly, that's the trifecta for, not good things happening. I believe is the technical term there, Doc.
Yeah. I mean, there's a lot of things that interplay to give someone cardiovascular disease, and the risk factors for atherosclerosis we mentioned are high blood pressure, high cholesterol, smoking, diabetes. Diet and exercise is vitally important. Exercise can make everything better or decrease the impact of everything. Diet cannot be overstated as well. There's many different diets out there, and certainly I'm not a wizard on selecting what is the best, but I think the Mediterranean diet is very useful. Even the old Atkins diet was very useful. It just takes a lot of self-monitoring and trying to avoid processed foods, canned foods with a lot of extra salt and preservatives and trans fats. But it's a daily chore for people to try to just get enough exercise and try to make some more healthful selections to try to not see me.
Well, and when you mention exercise, one thing I've learned on this program is exercise doesn't have to be training for a marathon or training if you were an old athlete in high school or college. That's not the type of exercise. It's getting out and at the very least going for a walk every day, doing something to get some movement. Is that a fair statement?
I think it's completely fair. What I counsel patients is on more days than not during the week, try to have sustained activity to get the heart rate up at least a half hour a day. 5 days a week would be preferred. If you can do it every day, hallelujah. But if you can't, 5 days a week for at least a half an hour a day, some level of activity, whether it's walking outside, getting on a stationary bike, getting on an elliptical or treadmill, walking at the mall, any of those such things, just get your heart rate up and sustain that level of activity, because that's the cardio part of it. It's not anaerobic training like lifting weights. It's trying to get the heart rate up, because that's what really balances out the blood pressure and increases your overall metabolic rate and burns off the extra calories to derive the beneficial effects.
Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center, is our guest this morning. We'll have more with Dr. Cindric on the other side of this timeout. Got to take a quick break. You are listening to Mon Health Talk on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Matthew Cindric is our guest this morning, Chief of Vascular Surgery at Mon Health Heart and Vascular Center. And Dr. Cindric, Mon Health recently shared that the Heart and Vascular Center performed its 100th procedure with the Inari Flow Triver? Triver? What is this, Doc? Come on.
Okay, so this was the Inari Flow Triver device. So okay. The background of this is that blood clots in the legs and the veins are extraordinarily common. Blood clots that migrate from the legs to the lungs can cause sudden death or severe chest pain and chronic pulmonary troubles, and that's called a pulmonary embolus. This is one of the facilities that is performing pulmonary thrombectomies to try to do emergency clot extraction of the lungs for people who come in various states of very poor health. Some people are literally unconscious and crashing with their blood pressure very low and their heart rate very high. Some people just have chronic shortness of breath and pain after a blood clot. So this made the news recently. There's been a various number of devices over several decades on the market, but this device is pretty slick in that you don't need to give high-dose blood thinning agents. You just go in once and done and take out a lot of clot. So it's sort of revolutionized the risk to benefit ratio and made it a lot more feasible and possible to treat people and get them back out of the hospital and back to their routine daily activities a lot sooner. So we celebrated, not just me, but in conjunction with the interventional cardiologists who were doing this before I got here, the 100th procedure using this company's device. So the outcomes have been fantastic. I'm glad to say it's certainly opened up my eyes to the benefits of technology.
I just want to say it correctly, Inari Flow Triver. I see it now in the words. But you mentioned technology and the advancements in vascular surgery. I'm certain, I mean, not to say this like you've been in the business for forever, but over the course of your career, you've seen the technology advancements to make this less invasive and easier for the patient.
Well, that's steadily true. I mean, since the time that I trained 15 years ago, there's just been a constant progressive evolution, and it does come in fits and starts. Sometimes there's a landmark device or landmark new technology that will come out, and then it just sort of cruises for a while until the next development. There's always a steady evolution out in the field of devices, mostly with stents and delivery systems, making it a little bit more low profile. For things like aortic aneurysm repair, it used to be where the vast majority of people would get open surgical repair and only the minority were candidate for stents. And year after year, there's a shifting of the percentages where more and more patients have procedures with minimally invasive techniques and have relegated open surgery to not quite the way of the dodo bird, but it's not quite extinct, but far less people get that. And it's not just the patient satisfied, but better outcomes overall.
Where are you seeing advancements, and what kind of advancements are being made right here in Morgantown?
Well, a lot of the advancements we're making now is through savvy contracts and just changing the structure internally of some of the common things just to get better, just better equipment all around. So that's not the same as new cutting edge technology. We're just over the past year, we've steadily revolutionized what we have in stock to treat the standard patient that comes in through our doors. So that's most of my excitement, is just sort of being a part of the team that's kind of rebuilding and making it the cutting edge of what currently exists for the program here. And it's not my baby, it's Dr. Garib's baby that he's bringing renal artery denervation to the program here, which is incredibly exciting. So for patients with chronic high blood pressure that are refractory to medications, there's and this is a separate talk in and of itself, but another procedure that may have dramatic impact in lowering someone's blood pressure.
You know, you talk about refining the equipment, getting the better equipment, dealing with patients, and what kind of patients you're seeing. And it's not necessarily, like you said, the cutting edge, big time, going to be in all the journals, but refining those procedures and just upgrading technology. Those are the kind of incremental improvements that maybe the patient, I don't know if the patient notices or not, but they notice it certainly if the procedure is a little less invasive, if they get to go home a little bit quicker. You get that improvement in quality of life without ever having to leave home here in Morgantown, Montague County. So all those little things that I'm certain you notice and you're working on, those all add up to big benefits for the patient at the end of the day.
Of course. And so this is where a lot of the charge that I have now is when there's not immediate new developments on the horizon that a large number of people are candidates for here, is just to do the constant micromanagement to refine the processes. So like for one example, unfortunately, part of my job description is that I'm responsible for a large number of amputations. And it's not something that anyone wants to live with or deal with, but a lot of people, unfortunately, are faced with this unpleasant position. And the care of the amputation patient is extraordinarily complicated, and it can involve multiple providers across different disciplines. And so one of the tasks that I have now is that I'm trying to develop an enhanced recovery protocol for post-amputee care and to coordinate the different providers and the alignment to try to really keep the patient centered so they can get through things as seamlessly as possible.
Talking to Dr. Matthew. Go ahead.
I was going to say, so none of this is necessarily a technological revolution. It's just trying to micromanage the whole process and keep the patient at the center to derive the best possible outcome.
Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center, is our guest this morning. I always like to pose this question to our doctors and our physicians, and I'm sure you're a great guy, you'd be fun to hang out with, but how do I avoid coming to see you?
Well, there's many different ways. I mean, you can learn more at monhealth.com/heart. There's referrals from different family providers, or there's a whole team of people that can negotiate through the system to accept referrals. I give out my cell phone number to everybody. I could do it on the talk show. I mean, there's many ways of getting a hold of us. And one of the things that I try to promise is that for referring physicians is easy access. I try to get people in record time to the extent feasible.
And what do you want folks to take away from our conversation today? If they remember nothing else, what do you want them to remember?
Oh, gosh, that's putting me on the spot for that one. Let's say get enough exercise, number one. And if you're concerned about having pains in the legs, tell your primary care doctor to consider arterial disease, because it's such a common problem. It's often overlooked.
And remember, I throw this in almost every show. If you're smoking, quit. Watch your diet and get some exercise. And those three things I have learned from a couple of years doing this show. That's my only takeaway, Dr. Cindric. If you do those three things, it will vastly help a whole lot of other issues as well. Dr. Matthew Cindric, Chief of Vascular Surgery at Mon Health Heart and Vascular Center, our guest this morning. Dr. Cindric, thank you so much for the time. I appreciate it.
Thanks for having me, Dave.